presenter. Hello everyone, my name is Amelia Schlossberg and I work at the Office of the Healthcare Advocate at Vermont Legal Aid. Today we're talking about healthcare advocacy resources and free legal help. So our plan for today's webinar is to start off with talking about Vermont Legal Aid, and then we'll go into the specifics of the Office of the Healthcare Advocate. We'll follow up with one of our main areas of expertise, which is getting health insurance and using health insurance. Then we'll discuss appeals and other legal issues. So Vermont Legal Aid is a nonprofit law firm here in Vermont, and the Office of the Healthcare Advocate is part of Vermont Legal Aid. We have 7 projects in 5 offices across the state, and Vermont Legal Aid works on civil legal aid, which includes healthcare, housing, education, public benefits, family law, consumer law, and more. We don't help with criminal cases, unfortunately, and you can see here on the screen the number for Vermont Legal Aid is 1-800-889-2047. That's our general number. And we'll be talking today about that very first bullet point, access to healthcare. So the Office of the Healthcare Advocate is one of the projects of Vermont Legal Aid. We have free help for anyone who lives in Vermont, so there are no income requirements and no resource restrictions. As long as you live in Vermont, you can get free help from the Office of the Healthcare Advocate. We have 2 parts. We have a free helpline that's the Advocacy Team. The helpline has advocates helping individuals with problems and legal issues. We have 7 advocates on the helpline team working under a supervising attorney. We can give legal advice, we can research your situation, we can explain your options, and sometimes we can pull strings at the state or the insurance company or the hospital to fix problems. We can also help you with appeals, and sometimes we can even represent you in a hearing. Secondly, we have a policy team. The policy team gives input at the legislature and with decision makers in the state government. The policy team represents Vermont consumers, and we work to change policies and laws so that Vermonters can have better quality, more affordable, accessible health care. And the Office of the Healthcare Advocate is here today with the Vermont Family Network because the Vermont Family Network works with so many families who deal with health insurance and health systems every day. This includes many family members with disabilities who are facing higher barriers to quality health care. And on the helpline, we help folks navigate healthcare systems and get care covered by insurance. On the policy side, like I said, we're pushing Vermont for higher quality, more accessible, affordable health care. So the first piece that we work on is helping Vermonters get health insurance. Now, more than 9 out of 10 Vermonters already have health insurance. The most common types are insurance from a job or school. Then there's Medicare for Vermonters who are over 65 or any age Vermonters with Social Security disability income for more than 2 years. Then there's Vermont Health Connect that has health insurance for people who don't get insurance from their work and who are not on Medicare. Many Vermonters can get state and federal discounts to make Vermont Health Connect insurance more affordable. And then finally, there's Medicaid, which is health insurance for low-income adults, adults who are between jobs, and lower moderate-income kids and pregnant people. Medicaid is special because you can sign up at any time of the year, and it's also special because Medicaid can work with other types of health insurance. Medicaid, I said, you can sign up for at any time in the year, but that's an exception. Usually you can't get health insurance any time of the year. You can only get health insurance during the open enrollment period. During an open enrollment, you can get health insurance and you can also change plans. For jobs, open enrollment is usually once a year. You can ask your HR when your next open enrollment period is. For Vermont Health Connect, open enrollment is from November 1st to December 15th. And then for Medicare Part D, actually each part of Medicare has a separate enrollment situation, so you want to get some detailed information about when the time is for you. But for Medicare Part D, the drug plan, open enrollment is each year from October 15th to December 7th. It's important to check to see if you're on the best plan or if there's a better plan for you during open enrollment. Now, if you've missed an open enrollment period or you're looking to change plans outside of an open enrollment period, there are special enrollment periods. Special enrollment periods happen when there's a qualifying event, like getting married, having a baby, or moving to a new state. These special enrollment periods are an opportunity for you to get health insurance or to change health insurance plans outside of open enrollment. And they usually have a pretty quick deadline, so usually about 30 days. Some are only 30 days, some are 60 days. So you want to check if you are expecting to change your health insurance plans or sign up for a health insurance plan during a special enrollment. You want to check as soon as possible when the deadline is. The next thing that the Office of the Healthcare Advocate helps with very frequently is helping folks use health insurance. So health insurance systems, there's sort of a common misconception that once you get health insurance, things are either covered or they're not. And it's actually much more complicated than that. And many folks who have complicated health situations know these details. So health insurance is broken down to a couple of different components. The premiums are the amount that you pay every month just to have the insurance, whether you use it or not. Then there are the deductibles and the copays. The deductibles and the copays are how your health insurance shares the cost of healthcare with you. Usually you pay all of your healthcare bills until you meet the deductible. Then you pay a copay or a percentage, and the insurance pays the rest. Networks are a way that plans work with a collection of doctors and pharmacies, which is called a network, and it's a way that they can limit how much they're paying for healthcare. If you go to a doctor or a pharmacy that's not part of the plan's network, the plan might not help you pay for that care. Then there's the plan contract and exclusions. The plan contract is a document that explains what your plan covers and what care is actually excluded. Your plan will not cover everything. There's also the coverage criteria. This is the situation where your plan could cover the care you need, but it might not cover it for your specific situation. Coverage criteria are the requirements you have to meet that before the plan will cover a specific treatment or medication. Usually these are more strict for expensive or specialty care. Prior authorizations are a requirement for you to submit paperwork before you get treatment. If you don't get the prior authorization paperwork approved before the treatment, the plan will not pay. Then there's the formulary and step therapy. These are ways that health insurance limits how much they pay for medications. The formulary is a list of medications that the plan will cover. If your doctor prescribes an expensive brand name drug, the plan can refuse to cover it until you try a cheaper treatment option first. That's called step therapy, when you have to try a different treatment option before you try the more expensive one. Finally, you have appeal rights. If your plan denies your prior authorization paperwork, you have the right to appeal the decision. Your appeal rights and the appeal timeline are in your plan contract. So we can use an example here. An example that the Office of the Healthcare Advocate works with very frequently are diabetic supplies and Vermont Medicaid. Vermont Medicaid will cover diabetic supplies, but they will often have some specific coverage criteria before they will actually pay for them. When you're meeting coverage criteria, it's important to use Medicaid's own words to prove that you meet the requirements. Frequently, coverage criteria include a specific diagnosis, whether you have an ability to use any other supplies that may be less expensive, and then whether or not the supply is medically necessary. Medically necessary means that the healthcare is appropriate for your diagnosis and condition, and it is important to restore your health or keep you healthy, keep you from getting sicker, make your symptoms better, or keep you from getting sick. Medically necessary is the bar for all care that requires a prior authorization with Medicaid, and some things have stricter requirements to meet this bar of medical necessity. Frequently, you need proof of medical necessity, and that proof for diabetic supplies usually comes from an endocrinologist or a primary care provider, and sometimes it comes from both. Sometimes you can get an exception to these criteria, so it's important to see when you're denied if you are interested in appealing. Usually these coverage criteria and the prior authorization happens behind the scenes with the doctor's office or pharmacist's help. That's fantastic when that happens. Sometimes the doctor's office and the pharmacy need some additional help, and they ask you to help, and sometimes you can get help from the Office of the Healthcare Advocate with prior authorizations. So if your prior authorization is denied, then you can appeal the denial. And there are a couple myths about appeals that I want to set straight. So there's a myth that if you appeal on a health insurance decision, you'll need a lawyer and you'll have to go to court to argue against the decision. And there's also a myth that if you appeal, you'll likely lose, that it's uncommon to win those appeals. And the reality is, go forward. The reality with these are actually myths. And the reality is that with appeals, especially for coverage appeals, you need not a lawyer, but actually healthcare providers to provide evidence. Generally, those healthcare providers are arguing with medical providers at the insurance company. And generally, the medical providers are better persuaded by healthcare providers than they are by attorneys. And then the myth that if you appeal, you're likely to lose. The fact is actually that the majority of appeals with MVP, Blue Cross Blue Shield, and Cigna and other major health insurance companies in Vermont, the majority of consumers win those appeals when they do an appeal. So you have very good odds of winning an appeal. And the Office of the Healthcare Advocate is glad to give you legal advice and assistance with your appeal, so you understand which arguments are most effective. And we're glad to work with you to decide whether an appeal makes sense and how you can argue for the appeal and what your best resources are in helping win that appeal. So there are two different kinds of appeals. There are coverage appeals and eligibility appeals. And I'll give a couple examples of each. So a coverage appeal is looking at what the health insurance plan agrees to pay for. And you can appeal whether if the health insurance plan has decided that they're not going to pay for your medication, you can appeal that decision. You can appeal the decision if the health insurance plan says they're not going to pay for your surgery or for a certain procedure. And you can appeal the decision if the health insurance plan says they're not going to pay for a specific test. Sometimes health insurance plans call a particular healthcare need that you have, they consider experimental. And you can appeal that decision and you can argue and give proof to explain that it's actually a well-documented best practice, not actually experimental. There are also eligibility appeals. Eligibility appeals aren't about whether or not the health insurance is paying for a specific type of care. It's about whether or not you get the health insurance in the first place. So the Office of the Healthcare Advocate talks with many folks who are experiencing Medicaid terminations. That's when you get a letter and the letter from the state says that your Medicaid is ending. You can appeal that decision and you can try to keep your Medicaid. We also find folks who have premium payment issues, especially with Vermont Health Connect, where there's been a mistake or a mix-up with the cost of their health insurance plan, or there's been an issue with paying the health insurance payments on time. We're happy to help you appeal any of those decisions as well. And then finally, the state of Vermont and Vermont Health Connect is dealing with so many people and so many applications that sometimes they do make mistakes with calculating income or resources. They can miscalculate things like family size or other variables as well. And so when people get your qualifications wrong, we're glad to help you appeal those decisions as well, especially if they apply the rules incorrectly. So when you're trying to win your case, for coverage cases, the most important thing is to persuade the decision maker that the care you need is medically necessary using detailed letters from your healthcare providers about your specific healthcare situation. The documentation is usually must be detailed and specific to you. And the Office of the Healthcare Advocate is glad to look through the prior authorization requirements or any other coverage requirements and help you argue that you fit in those requirements, if that's true. And we're also always looking to do specific work within individual cases on the helpline. And we'll also have the policy team that does big picture work to see if we can change some of these coverage criteria so that in the future, folks have an easier time accessing the healthcare that's medically necessary for them. Now, when you're trying to win a case with an eligibility determination, you're trying to persuade the decision maker that you qualify for the program using the specific rules of the program that apply to you and your specific situation. Again, the documentation should be detailed and specific to you and specific to the rules. The advocacy team at the Office of the Healthcare Advocate are experts in reviewing the current rules to find the most effective legal arguments. We can give you the rules that you can quote to make your argument and to help you argue. Our office is really good at playing by the rules to help you get your care covered. And again, the policy team is the side that does the big picture work to help change the rules when the rules are unjust. The Office of the Healthcare Advocate is also glad to help folks that are uninsured or don't have health insurance. When someone is uninsured, you have some options. We're glad to help you try and find a pharmaceutical company discount if you have a medication you need while you don't have insurance. We're glad to help you try and find charity care that you qualify for or a discount program that you qualify for, either based on your income or based on being uninsured or some other situation. And we're also glad to help you figure out how to get health insurance in the future when you're able to do that. We also have, there's also the penalty for being uninsured on your taxes, and we're glad to help you try and find an exemption from the penalty for any years that you're uninsured. So finally, we do have a couple other areas of legal advice that we're able to give. We give some advice about complaints when a healthcare provider is not treating you well. We're glad to point you in the right direction for someone to investigate that complaint. You have the right to go to these places to make a complaint about providers, and they have to take it. But in practicality, it may not always guarantee the outcome that you want when you make a complaint. So it's important to weigh the decisions to go to these entities carefully, and the Office of the Healthcare Advocate is glad to talk through your options and help you weigh those possible consequences. We're also glad to give advice about privacy and the Health Insurance Portability and Accountability Act, about your confidentiality. There's a federal resource there for investigating privacy and HIPAA issues, which is the Health and Human Services Office for Civil Rights. We also give some advice about medical bills. So if you have a medical bill that was not covered by an insurance company, there's a timeline for appealing that medical bill. And we're also able to talk a little bit about medical debt. We're also able to help you connect with other areas of Vermont Legal Aid. So like I was saying, Vermont Legal Aid has many projects, and the Office of the Healthcare Advocate is the primary project that focuses on healthcare, but there are other projects that focus on healthcare too. There's the Vermont Long-Term Care Ombudsman Project. There's the Mental Health Law Project. There's the Disability Law Project, and there are several others that also do some work with healthcare, and we're glad to connect you there too. We also give some help with health insurance and taxes. It's kind of a little known fact that we have a tax attorney on staff, and there are a lot of intersections between health insurance and taxes. So we're glad to help you understand health insurance and tax issues like your 1095A or other parts of your other health insurance tax questions. So from here, the Office of the Healthcare Advocate is glad to help any Vermonter who has questions or issues with healthcare. You can reach us by phone at 1-800-917-7787. When you call us on the phone, we're often not able to answer the call live. So if you don't have us pick up the phone, then you can leave us a quick voice message with your name and phone number and a brief description of why you're calling, and we'll get back to you as soon as possible. If something is urgent, please explain why it's urgent, and we'll aim to give you a call back that exact same day. And if something is able to wait longer, we might take up to 3 or 4 business days to get back to you. Maximum will be 5 business days if we're very, very busy and your concern is a lower priority. For instance, we get calls from people who are looking for some advice about going onto Medicare in 6 months. And if their plan is they're planning ahead for 6 months in advance, we're very excited to help them, and we probably wouldn't be able to give them a call back exactly the same day with that kind of long-term question. So we also have an email address, which is hca@vtlegalaid.org, and you can send us an email with your question. And then we also have a website, which is www.vtlawhelp.org/health. At that website, we have lots of legal information that can help you with your healthcare questions. And we also have an online help request form that's confidential. You can submit a request for us for help. And so at this point, we've got some questions. Okay, so the first question here is what kind of forms do you need to fill out to get help from the Office of the Healthcare Advocate? And are there any eligibility requirements like income or anything else like that? And the Office of the Healthcare Advocate actually doesn't have any income requirements at all. So we're happy to help any Vermonter, regardless of income or other resources. And we don't need any forms from you to start getting help. All we would need is a phone call from you, or an email, or an online help request. We're glad to answer any questions you have, and there isn't any paperwork that you need to fill out to get our help. A lot of our cases actually just start with a phone call, and sometimes they can be resolved with one phone call. If someone has a quick question about Dr. Dinosaur eligibility, oftentimes we can just give them a quick call and answer that question right away. Or sometimes people have a longer term case with us where we're helping them with an appeal process, and it can be 6 months to a year where we're helping and talking on the phone and sending emails back and forth and working with them in a longer term capacity. So we have another question here. My insurance company doesn't have anyone in network that's accepting new patients. How can your office help me? So the Office of the Healthcare Advocate is glad to help folks who are having difficulty finding healthcare providers. That's one of the things that we work on. And one piece we can do is we can help you connect with the insurance company to get an accurate look at what the network is. We can also help you file a complaint with the insurance company about having an inadequate network. And we can also, with certain insurance companies, but in particular Vermont Medicaid, we have some connections at Vermont Medicaid that we can talk with to help find an exception and find someone who could help you and is willing to take Medicaid for you in that particular situation, even though they're not generally in network. So another question here is, can you join me on a telephone call with my insurance company? That's something that we would definitely do. We don't really like to, I know sometimes we get phone calls where someone's calling and they're saying, okay, we're going to call the insurance company together right now. And we say, hold up a second, let me do some research first and figure out the rules and the laws that apply in the situation. So we want to plan it in advance, but we would be glad to talk with you and your insurance company to figure out how we can help you and help the insurance company understand your arguments or understand your situation better. Depending on the insurance company, sometimes we have some connections there that we can try and connect you with that are a little bit more helpful than the customer service that the average Vermonter can reach. The next question here is, can you talk with my insurance company on my behalf? And we have a situation set up with Blue Cross Blue Shield and MVP, Vermont Health Connect, and Medicaid, where we are able to talk with the insurance companies on Vermonters' behalf without any kind of paperwork. If you give us permission over the phone or in an email to talk with those insurance companies, we'll take that permission and we're glad to talk with them on your behalf. We would never talk with someone without your permission, so we would need permission from you. But it doesn't have to be written down. It can just be oral permission over the phone. And those insurance companies will talk with us if we have some information from you. If we're able to verify your identity just with your date of birth and your social security number, then we can talk with those insurance companies and gather information for you on your behalf. Okay, so the next question is, how many people walk into the office of the healthcare advocate? Work, sorry. Well, actually, that's two good questions. So one question here is, how many people work in the office of the healthcare advocate and who pays for our services? So the office of the healthcare advocate has 7 people on the helpline, the 7 healthcare advocates who work on the helpline. Then there's a supervising attorney, then there's a chief healthcare advocate. There are 3 policy individuals, and there's me doing outreach and communications and trainings for the Office of the Healthcare Advocate. That's how many folks work at the Office of the Healthcare Advocate. Again, we're part of the larger Vermont Legal Aid organization, which has about 80 employees. And we do, the other question is, you're a helpline, but are you able to walk in and go and meet with someone in person? And we are able to take walk-ins with a little bit of advance warning, especially if someone needs that as an accommodation for a disability or a language barrier or something like that. We're glad to help with someone in person, but generally we are set up as a helpline, so we help people over the phone and over email in that way. Okay, so there's another question here, a specific situation. What if my insurance company that is self-insured is refusing to give me a denial letter for medically necessary services that my child needs, so I can't get Medicaid to pay? What can I do? So that's a really good question, because Medicaid is generally secondary insurance. So if you have Medicaid and another type of insurance too, Medicaid will only pay if the first health insurance has already been billed. And generally they'll actually only pay if the first health insurance has been billed and is paying. Usually they follow the rules of the first health insurance. So if there's something that Medicaid oftentimes covers, but your primary insurance doesn't cover, usually Medicaid won't pay for it if the primary insurance denies it. But there are some exceptions to that. And so if you can get a denial letter from the primary insurance, sometimes you're able to get Medicaid to pay even though you have a denial letter. But if the primary insurance isn't even willing to give you a denial letter, that would be really tough, because that would mean that Medicaid has no way of knowing if you've even tried to have that insurance pay for it yet. And because Medicaid is state funded by all of our taxpayer money, they want to try and get someone else to pay first, and they are only the payer of last resort if no one else will pay. So if you're not able to get a denial letter from the primary insurance, for example, if they're self-insured, that'd be a really good time to call the Office of the Healthcare Advocate to get an advocate to help work on that case for you. We'd love to try and help you with that specific situation. There could be a number of reasons why they're refusing to do that. And so another question here, I was saying that Medicaid is taxpayer funded, and the Office of the Healthcare Advocate is also taxpayer funded. So we were created by the legislature in 1998, so we're 21 years old now, and each year the state legislature puts us in the budget, and they provide us with our funding for our positions to do this advocacy work on behalf of the state, on behalf of state residents. And we're a grant-funded Office of the Healthcare Advocate. So each year, every couple of years, we apply for the grant, and the state of Vermont decides where they're going to give that grant to. And for the past 21 years, that grant has gone to Vermont Legal Aid to have the Office of the Healthcare Advocate. Okay, so another question about how quickly we're able to respond. So at the Office of the Healthcare Advocate, just so you know, when you give us a call or send us an email, we get those messages and we triage those calls and those emails, unless we're answering live, and we do answer live regularly. And when we triage those calls and those emails, we look to see what the issue is and whether it's an urgent question that needs to be answered the exact same day, or if it can maybe wait another day or two. And so for questions that are coming in where someone's having an urgent issue, for example, if someone's at the pharmacy and they can't pick up their insulin and they give us a call saying, I'm out of insulin and I need to help figuring out why I can't pick it up, what's going wrong with my insurance, we would call them back that exact same day. And we always have someone at the Office of the Healthcare Advocate who is able to take those same day questions, those emergency cases. For cases like I was saying, where there's a little bit more time, say we oftentimes get calls with someone saying, okay, I'm planning to change my health insurance in 2 or 3 months. I'd like to know what I can do at that point so I can plan for the future. With those situations, we might take a couple days to call back just so that we can prioritize the calls that are coming in from someone who's having problems accessing healthcare. So the longest it would take to give someone a call back would be 5 business days. So that would be the absolute longest, especially when we're very, very busy in our busiest season. Usually you get a call back within 3 days at the absolute most. So 5 would be quite long, but you could expect 3. So a question here too is, are you able to help healthcare providers, not just individual clients? So if there's a healthcare provider like your doctor who's having difficulty with health insurance, how much can we help the provider, maybe even on behalf of the individual patient that they're working with? That's a little bit tricky because we are paid by the state of Vermont, by the taxpayers, to help individual Vermonters. And we know that healthcare providers oftentimes have other resources that can help them because it's their business, it's their full-time job to work with insurance companies and to figure this part out. They oftentimes have their own lawyers, especially if they work for a large organization. So we're not able to help much with service providers, but when they do have an individual patient that needs help, we're glad to work with healthcare providers to help that individual patient. So if a doctor was calling and saying, I have a problem with an insurance company, but it's not impacting my patients, we would probably direct them back to the insurance company or just some other resource. But if they were calling and they're saying, my patient is having this problem, she can't access this medication she needs, my wit's end, I don't know how to help her, we would be so glad to help that provider understand the health insurance process and work with the insurance company to get some good documentation of the medical necessity of the care. And that's one of the most important times when we're collaborating with healthcare providers. We don't have any healthcare providers on staff at the Office of the Healthcare Advocate. So if someone needs a prescription written or a letter from a doctor that's proving something, we can't write those letters and we can't write prescriptions or anything like that. But we can help providers understand the criteria and the laws and the regulations around the work that they're doing so that the providers know how to write the most persuasive letter possible with their own opinions. So the next question here, what are some of the biggest misunderstandings about insurance from people that we help? I think one of the big misunderstandings about insurance is this piece that is really specific to the health insurance industry, and it really doesn't happen anywhere else. But with health insurance, if you get behind on your bills, if you get behind on paying that monthly premium, and you lose your health insurance, you can't usually get it back until the next year. So we find folks who are having some premium payment issue where they are not quite sure how much the payment is, or they're not getting bills on time, so they're not paying on time, or they're having some other problem where they're not making those payments on time. Maybe they think that they are, but they're actually not, or they're just kind of confused about it, and they have other priorities they need to work on, and they're not quite sure what to do. And then sometimes even at the beginning of the year, maybe they got the health insurance in January, on January 1st. By the end of January, February, we see folks that have their health insurance closed because of a payment issue with those premiums, that monthly amount you need to pay to be subscribed and to have that insurance, whether you're using it or not. And that's always really awful, because in any other situation, say maybe you get behind on rent, usually you can get caught up and you can keep your housing. You get behind on your electric bill. Even if they get to the point where they're turning off the lights, you pay up and they can keep having that electricity coming to you. You get behind on any other bill. With health insurance, you're really, really stuck. And we are sometimes able to help people find some loophole or some rule that the insurance company didn't follow, or figure out some argument. But somewhat regularly, we're giving people just the bad news that the health insurance system is not set up to help you if you weren't able to figure out your health insurance bills with no gaps. So sometimes folks are stuck without health insurance, without coverage that they needed and they wanted for 10 months even, until they can get health insurance the next year. And that's always really stressful. And so I think that big misconception that people have is that they can put off figuring out their health insurance premium payments for later, when really that's one of the number one priorities that you really, really can't put off. If you're going to keep your health insurance, you've got to figure out how to pay for it, because usually they'll cut you off and you won't be able to get back on again until the next open enrollment. That's particularly an issue with folks on Medicare as well, with Vermont Health Connect, with other kinds of insurance. Oftentimes folks that have insurance through their employer get used to having the money taken out of their paycheck every month. And when they go on to some other kind of health insurance where it's not an automatic payment, they end up with problems. So that's always really awful. I think that's the main thing. The other big misconception I mentioned earlier, and that's that it's not worth it to appeal, because we really do find that the majority of appeals are successful, that the consumer wins and the insurance company actually does change their mind and actually pay for the care that they need. And that's really important for folks to know, that it's oftentimes very worthwhile to do an appeal. So let's see if there are any other questions today.
I don't see any other questions. I'm glad we're ending on a positive note.
Yeah.
I appreciate thank you for your time today. It was really helpful. I want to thank everybody for joining us today. You can visit our website at vermontfamilynetwork.org, where you'll find lots of resources. We'll have our upcoming webinars listed there, and of course, lots of information about our annual conference. We're going to save this webinar with all our other webinars on our YouTube channel and also on our website. And we always want to talk with people if we can help you in any way. So please give us a call, toll free at 1-800-800-4005, and have a great day. Thanks.
Thank you.